Conditions related to glucose regulation by Kayla Noburn. Okay, my first topic is hypoglycemia. This condition occurs when you have low blood sugar. And here I included a picture of an example of low blood sugar. It can be caused by lack of carbs, incorrect dosage of insulin, and also skipping meals. Symptoms of this condition are sweating, shakiness, headaches, hunger, and sleepiness. Hyperglycemia. This condition occurs when your blood sugar is high, and this is an example of a high blood sugar number. Symptoms of this condition are dry mouth, increased thirst, blurred vision, and frequent urination. Causes of this condition are not using enough insulin, being inactive, and also using steroids. Comparison of hypo and hyperglycemia. The difference between the two is that hypo shows a low amount of glucose in the body, while hyper shows excess amounts of glucose in the body. In this picture, it shows their glucose level for each condition. The hyper with the low blood sugar, a normal level with no condition, and also hyperglycemia with a high blood pressure. High blood sugar. Type 1 diabetes. Type 1 diabetes is caused when your body is fighting an infection which your insulin producing cells of the pancreas are being attacked. Symptoms include increased thirst, bedwetting in children who don't usually bedwet, extreme hunger, and fatigue. Here's some more symptoms that we have: weight loss, hyperventilation, breath smells of acetone, nausea, vomiting, abdominal pain. Type 2 diabetes. This is caused by obesity and an inactive lifestyle. Well, those are the top two causes. It is shown that in this picture that the cell isn't responding to the insulin, which is called insulin resistance. Some symptoms include strong thirst, itch, weakness, slow healing of wounds, constant feeling of hunger, frequent skin infections, dry mouth, frequent urination, numbness and previa of the legs, and visual impairment, which are very similar to the symptoms in type 1. A comparison of the two. Type 1 cannot be prevented, while type 2 can be. People with type 1 don't produce insulin, while people with type 2 don't respond to insulin properly. Type 1 is an autoimmune health condition. Type 1 diabetes is caused by a body attacking its own pancreas with antibodies. Type 2 diabetes is also known as non insulin dependent diabetes. In type 2, insulin is produced by pancreas, but in small amounts. And